At this point in the procedure, you've identified your insertion spot with ultrasound and you've put on your gown. Next, sterilize your spot with the chlorhexidine swabs that are included in the kit, swabbing in circular motions from inside to out. Now you're ready to open your sterile gloves and put them on. Take the sterile drape and, using the directions on the drape, unfold it appropriately over the patient. You can fold it in half like this to help approximate where you will place the opening on the patient. Unfold the drape as such. An unsterile assistant can grab the lower edge and pull the drape over the rest of the patient's body. Remove the blue covering of the drape, revealing your insertion site. Next, you'll prepare the sterile cover for your ultrasound probe. Uncover the packet, revealing the gel, the rubber bands. Set these rubber bands aside. Be careful not to discard them. Find the opening of the cover and place your non-dominant hand inside. From the other end, push your dominant hand through. With this hand, you will grab the ultrasound. Your unsterile assistant should have placed gel on top of the probe. Then, with your non-dominant hand, pull the edge over the entire probe, making sure to cover the cord. Again, your non-sterile assistant can grab the lower edge to pull the cover down. Smooth the probe, making sure there are no air bubbles. Pick up your rubber bands and secure around the probe. Next, you can set up your tray. Have your unsterile assistant drop 3 caps into the tray. Take the caps and attach each one to the port ends, leaving the brown port without a cap. Next, remove the sterile flushes and flush each port in order to remove any air. To flush the brown port, you can take the third cap and attach it to the flush before you flush the last port. Just remember to keep the brown port without the cap on. Next, check your guide wire. Remove the small cap and make sure the guide wire moves freely within the sheath. Here is your lidocaine that you will use to provide topical analgesia. drop your lidocaine like this. And when you're done, remove the blunt tip needle. Insert the needle onto the syringe that is now filled with your anesthetic. Apply a small amount of the sterile ultrasound gel onto the site. Using your probe, search for the internal jugular vein. Infiltrate the skin with the 1% lido around the needle insertion site. And insert the needle under your probe and find your tip. Aspirate to ensure you are not within a vessel, and then proceed to inject your anesthetic. Retract your needle after use. Pick up the steel introducer needle attached to your syringe. It's advised to remove the steel tip needle and reattach it again, as it may be difficult to remove later on otherwise. Enter the skin with your needle while holding negative pressure. Simultaneously visualize the needle tip on your ultrasound screen as it advances towards your jugular vein until it is seen perfectly within the center of the lumen of the vein. When this happens, you should have a sudden release of negative pressure as blood is aspirated into the syringe. Once you have return of venous blood, stop advancing the needle immediately. Set your ultrasound probe down and firmly grab the needle with one hand while anchoring it down against the patient. With the other hand, take off the syringe. Grab the guide wire and thread the wire into the introducer needle hub. The wire should feed into the vessel smoothly and without any resistance. If you feel resistance, you should stop. Notice you will see on the wire that there are black lines that indicate the depth of the guide wire. You can feed to a depth of approximately 20 centimeters, which is marked by 2 black lines. Pick your probe back up to confirm the correct placement of the guide wire within the lumen of the target vessel. Use one hand to firmly hold onto the guide wire while using the other hand to carefully remove the introducer needle. It's important to never let go of the wire at any point until it is completely out of the patient. Set the needle down and grab the end of the wire in one hand while loading the dilator onto the wire with the other hand. Grab your scalpel and place a nick onto the skin at the insertion point, just large enough to accommodate the dilator.
No, that's good. Super close. Look at this, right?
You can manipulate the wire up and down to ensure a clean cut. Insert the dilator over the guide wire with a steady twisting force at the proximal end in order to prevent kinking of the wire. Once you've reached an adequate depth, you can then remove the dilator while still leaving the guide wire in place. Insert your triple lumen central line over the guide wire. Advance until you see the distal end of the guide wire emerge from the middle or round port. You may have to feed wire outwards until it appears there. You should grab this tip and continue to advance your central line until an adequate depth is achieved.
Oh, okay. Like this. Sorry, okay. There you go. Yeah,
For right internal jugular vein, this is typically 16 to 18 centimeters depth. Use the markings on the central line to tell the depth. The 2 bold dash indicates 20 centimeters with 1 centimeter increments marked by the single dash. Once the catheter is advanced to the correct depth, pull the guide wire out of the patient completely. This is a very important step to take mental note of. Grab the flush with the loaded cap and aspirate blood into the brown port to ensure correct placement in the vessel. Then proceed to flush the line. Clamp the line and repeat for the other 2 ports.
What's happening?
I don't know. It's a return.
Oh no, we have to show return.
It happened with
This is fun. I haven't done a central line in a while. Give me return. Oh, it's just like, oh, it's very light.
Very
It's
light.
very light.
Look close, look close. Or get closer maybe?
It's so it's
It's so blue.
it's just very faint.
Okay.
Yeah.
It's okay, we can see blue. We
Yeah.
can see blue. Okay.
It is the lightest of blue.
Try the brown port again.
This one is also
So light.
just so light.
Yeah, the background is blue. Yeah, we can't really change blue
Yeah.
because the red is for arterial.
Yeah.
Okay. Get it on the white background maybe.
On the white background. Some air too. It's
Yeah.
kind of, yeah. Maybe because, yeah, it's very hard to see it in there.
That's okay. We're
Yeah.
going through the motions. The
Yeah.
idea is that there's left return. Okay. I mean, that could be the next edit if we want to do it again to just like make sure that the code.
These last steps are about securing your central line onto the patient. This is done by suturing the line in place. First, take this white attachment and snap it over the insertion point. Over that, you can place the blue attachment. Just make sure the 2 holes on the wings line up perfectly. Each kit should come with a suture and a needle driver. Use these to secure the central line in place as such. Just be careful not to stick yourself. You can first guide the needle through the hole on one wing and then grab the adjacent skin with your needle. Make a simple interrupted stitch to lock the one side in place.
Is this close enough?
Yeah.
A little, could be better.
No, it's good. It's good. I mean, it's.
Simply repeat on the other side.
I'm not straining to see what you're doing. You know, it's just not like super detailed, but I think that's okay.
Maybe
I
they
think if the
differ
point
on a
is-
computer. Maybe when we see on the computer.
Yeah, on the computer you can blow it up, but I think
Yeah.
the point is
Although not shown here, this other attachment should also be sutured down onto the patient and can be done so that the catheter loops around away from the patient's head. And that's essentially the complete procedure. Just finish it off by applying the Biopatch and then removing your drape.
Do you think there's a way to make this video look down a little?
Don't forget to order your confirmation chest x-ray and then write your procedure note.
Like that's how we do with the steps in this. Like make it like a DVD where you can fast forward to like draping, ultrasound. Not really so much links, but like when you're going through a video and you're like, okay, I want to watch the first part of setting up the kit, etc., and finding my landmarks like at my desk. But then in real time, I want to.
Nice work!